Hey everyone, it's Chris. Back in my office, I figured we could talk about a topic that's still relevant: burnout. Burnout is exhaustion and collapse due to prolonged stresses from work. If you're watching this, especially my fellow nurses, you know exactly what I'm talking about. But see, why is that? Why nursing? I've been a nurse for around 10 years now. I've been in many different challenging areas of work, like the nursing home and emergency room and med-surg in busy hospitals. I am no stranger to burnout. I got to the point where I was gonna quit nursing for good. I felt like I made a mistake. I felt stuck. I felt like I was trying to fit into areas where it just wasn't working out. As a new nurse, I felt so unprepared. I didn't know how to talk to people. I didn't know who to talk to. I didn't know who to ask for help. I kept feeling like I wasn't smart enough, like I was always playing catch up. And then I thought, how come there are some other nurses that are able to stick through it, meanwhile I'm struggling? So then I thought, maybe it's the place, maybe it's where I'm working. So I tried different places to work. And then I kept hitting the same obstacles. So then I soon realized it wasn't me. I wasn't the problem. It was the system. Problems like short staffing, high nurse to patient ratios, lack of supplies, and lack of support from management. These aren't unique to just one place. It's practically everywhere. And to my fellow nurses, you know exactly what I'm talking about. Many of these places don't train nurses well or give them the support they need to be functional. There are some nurses that make it in these areas despite the obstacles, but that shouldn't be the standard, wouldn't you agree? The sad truth is, the United States healthcare system is a business. Oftentimes, or arguably all the time, the financial bottom line means more than actual care. And as long as that persists, the same obstacles will exist. So then what can you do? Is nursing even worth it? That's a question I used to always ask myself. And despite all that I've seen, I think it's worth it. It's in demand and rewarding if you find your niche. Nursing is a broad profession. I ended up in an area of nursing that I didn't even know existed, and I love it. I think nursing schools should give more exposure to all the other areas of nursing besides the major areas like med-surg or emergency room or the ICU. My advice is to not focus so much on the specialty or the population that you like. Instead, focus on the role. Your desire can always change, but the role is what keeps you rooted and can help prevent burnout. For example, do you like a more hands-on role? A clinical role? Do you like a more hands-off role? Do you like a more administrative role? Do you like a more procedural type role? There are so many roles, but the bedside role is notorious for causing burnout. It's because there are too many tasks, which often include non-nursing tasks. So pair that role with the other obstacles that I mentioned. It sounds like a recipe for disaster. No matter where you work, if you stay in that same role, you're eventually going to hit the same obstacles, especially if it's a role that you didn't work well with in the first place. Here's my example. I always wanted to be a CRNA. For those of you that don't know, that's a certified registered nurse anesthetist. I find it cool how they are so skilled and specialized. And back then, being at the bedside, it looked even more appealing. That motivation got me through most of schooling and even the hard days at work. I had everything planned out, but then when I got my first taste of critical care, I found out 100% that was not for me. It was such an eye-opener. I couldn't make myself like the role of a critical care nurse, no matter how I framed it in my mind. So, thinking my dreams were shattered, I took some time to really analyze what I liked about the CRNA role. Autonomy, specialist knowledge and training, further schooling, money, and most importantly, not the bedside. So being desperate to just not leave the profession, I looked back to every other experience that I've had. I wanted to see if there was something that interested me. So I realized, you know, in all my experience, I treated many wounds at the bedside and worked with wound care nurses and wound care physicians. Why not wound care? I know it's opposite of critical care, but then again, critical care wasn't for me. I was so excited to find out about the CWOCN certification and that you had to go back to school for it. It felt like I had purpose again, like I was doing something serious. I attended one of the programs, which is in Rutgers University, and I felt like I found exactly what I was looking for. Now as a CWOCN, I have autonomy. I have specialist knowledge and training. I had to go back to school for it, and I also had to get certified. It doesn't inherently make much as a CRNA, but it does make good money, not to mention job flexibility. And it's not bedside. The specialized knowledge and training erased my prior fears of working in the hospital, such as dealing with complex cases and collaborating with the interdisciplinary team. I used to be so shy to even give report to other nurses, and it was the same with talking to patients and patient family members. But now I do presentations, I educate so many professionals and students, and also patients with confidence, and I do that regularly. Why? Because now I know I'm prepared, and because my role role fits me. It doesn't matter where I work. It doesn't matter who or what I encounter. I know I can avoid burnout because I know I'm prepared and because I love what I do. I also want to note that there are many other nurses that love the bedside role, and I applaud them for that because they are very much needed and it's a very necessary area of nursing. So to conclude, if you're a nurse that's struggling, if you're in a role that doesn't feel like it's working out for you, please be open to other roles. Search up what's out there because chances are those roles exist. You are smart, you are talented, and you are very much needed. Don't let any workplace make you feel like you're not good enough. Take it from someone who almost left the profession and then ended up staying and loving it. For me, it was wound care. For you, maybe it will be wound care too, or maybe it'll be something else. But if you don't look, you won't find it. Well, that's it for now. Please like and subscribe. Share this with your coworkers or your friends. Links to my other account are in the description below as usual. And also, let me know in the comments if there's any other topics you want to discuss. Until next time, stay vigilant.